Hi, Mr. Carter. My name's Kim. I'm going to be your nurse for today.
Okay.
So what I'm going to do is I just need to get like an assessment on your belly, on your abdomen, okay? Okay, so as you're laying down. So first what I'm going to do is I'm just going to look at your stomach. It's a flat stomach, no signs of scars or anything. I can tell you have like a little mole. It's actually not on your stomach, but right underneath your nipple. So you might want to watch that. It's kind of raised a little bit. So what I'm first going to do is I'm going to take my stethoscope and I'm going to listen to bowel sounds, okay? And that's just the sounds that your belly makes, okay? Okay. So your bowel sounds are active. What I'm going to do is I'm actually going to listen to all 4 quadrants of your abdomen. And they're normoactive. They're not hyper or hypoactive. No problems there. Okay. So what I'm going to do is I'm going to take the other side of my stethoscope and I'm going to listen to the arteries in your belly, okay? First I'm going to listen to the aorta. So what I'm listening to right now is your aorta, okay? Just making sure there's no bruise or breezes. I'm going to listen to your renal. And then just right above the hip bone, I'm going to listen to your iliac arteries. I'm not hearing any of those bruise or breezes. And then I am going to have to take it and I'm going to put it right inside your groin, okay? Just right inside your underwear. And you sound good there, okay? Okay. So what I'm now going to do is I'm going to tap on your belly. And remember, like when I did chest on you, I'm just going to place my hand on you and I'm just going to lightly tap, okay? And what we typically hear is tympani. Right here, you hear the difference. So it's hollow over there, which is normal. Okay. So what now I'm going to do is I'm going to palpate your abdomen. Just like I'm just going to use one little hand and I'm just going to rub. And you tell me if it's tender, if anything hurts or anything, okay? Anything hurt? Just going to do like a little rolling in. If you feel any pain, just let me know. Any pain? Any pain in there? Okay. So now what I'm going to do is I'm going to do deep palpation. I'm just going to use 2 hands. I'm going to push just a little bit in more, okay? Any pain? Okay. Any pain there? Okay. So what I'm going to do now is I'm going to fill up your liver. So I just want you to take a deep breath for me, and I'm going to push in over here, and I want you to hold it, and then let it out, and you can tell me if there's any pain, okay? Okay, deep breath. Keep holding it. Okay. Let go. Any pain over there? Okay. So now what I'm going to do is I'm going to find your spleen, and we're going to palpate that too, okay? So I'm just going to do... Here, I want you to take a deep breath and hold it for me, okay? Okay. Feels normal. Not enlarged or anything. Okay, blow it out. Any pain over there? Okay. So now I'm going to palpate your kidneys. You're fine there. Any tenderness? Okay, so now what I'm going to do is I'm going to palpate your lymph nodes. I've actually brought a towel because I'm going to have to go inside your shorts a little bit, okay? I'll do it really quick, okay? Thank you, Carter. Okay, so I'm just going to palpate here. Okay, nothing tender. Anything hurt down there? Okay, I don't feel any enlarged lymph nodes. So I'm just going to go in here. Sorry, Carter. Okay. Thank you, Carter. Any tenderness? Okay, I don't feel anything. Okay, so also one more other thing I'm going to do is it's called a Murphy sign. And what I'm going to do is I'm just going to curl my thumb right underneath your rib cage. I want you to take a deep breath and tell me if when I push in if you feel any pain, okay? Okay, ready? Any pain? Okay. Deep breath. Any pain? Okay. And one more with that. I'm just going to lay my hand on it. I want you to take a deep breath. I'm going to hit on each side with my fist, but it's just going to be a really light, kind of like the percussion, but it's just going to be a slight. I'm going to do both sides, and you tell me if it feels the same on each side or if one side has more pain, okay? Okay, ready? Deep breath. Hurt. Any different or any pain? Okay, that's it. Sound good? Okay, thank you.